we've gone through the pregnancy journey and we have our bundle of joy, it's time to whip up that body into shape the healthy way. You know that generally during the pregnancy, you gain some weight due to the baby, the placenta, the general fluid retention and all that. But after delivery, you need to shed off some of the weight, and there are ways of doing this in a healthy way. Join me today as I talk to our guest speaker, our dietitian by profession, Sophia Ametefe. Let's move on to the area of exercise.
Okay.
When should we start our exercise? In fact, in the first place, how much exercise is good for us? When should we start? And then what type of exercise can we do?
So the advice is that before a mother decides to embark on any form of exercise postpartum, get clearance from your doctor. That is the advice.
Okay.
Because someone may have undergone cesarean section, sutured well, everything, but there may be some tear somewhere or some complications we are not aware of.
Okay.
So if the mother does not inform the doctor and goes to do something excessive, she may end up developing some other complications. Maybe a mother delivered on her own but had a tear which was stitched, and she's supposed to allow the place to rest and heal. But immediately she embarked on some form of extreme or vigorous exercise, you could have some effect. So for me, I would advise that get clearance from your doctor, and then you can have the physiotherapist or any fitness coach advise you on the specific exercises to do. Fortunately, with advancements in technologies, there are some postpartum videos that have also been uploaded on recommended or trusted sites. So you can visit them and practice along with them.
Speaking of exercise, on today's show, we have a fitness coach who will take us through some of the safe exercise modalities for us after delivery. We'll go back to Sophia. You know the caffeine, it's very good for energy boosting and all that.
Exactly.
When you resume work, especially in the corporate world, they drink a lot of coffee. Yes. What's your take, or what is it about caffeine and breastfeeding? Does it affect it positively or negatively?
Okay. So breastfeeding mothers are not supposed to go beyond 200 milligrams of caffeine intake daily. How
does that translate into, for us to understand?
In preparing your coffee, each can or each sachet would usually give you the volume and the amount of caffeine it contains. So if you follow that guideline, you'll be able to tell whether you are meeting, whether you are within the guideline or out of it. But we still do not encourage it frequently, because a breastfeeding mother who is also taking her coffee should know that the caffeine can be transmitted from the breast milk to the baby. As an adult, when you take caffeine, what does it do? It keeps you awake. So when it indirectly goes also to your baby through your breast milk, baby is going to keep awake for long hours. So when your baby is not sleeping, you have no cause to complain.
That's very enlightening as well. It's been a great show with Sophia Ametefe today. Can you give us a summary?
Breastfeeding is a very essential tool that every mother within her means should be encouraged to do, unless there are reasons why a mother cannot exclusively breastfeed. Because there are health benefits both to you, the mother, and to you, the baby as well. After breastfeeding, the next thing is what? As a mother, you desire to go back to your former weight or as close as possible, because pregnancy comes with weight gain. So what do? Embark on a healthy eating plan. Watch your oils. Ensure that you are eating your breakfast, your lunch, and your supper. You are opting for healthy snacks in between. Don't go in for the junks, the fries, the chips, the pastries, and all the soft drinks that would not help you in any way. And then be active. So once you fully, exclusively breastfed your child after 6 months, you can now begin to gradually embark on a full weight loss program. Because remember that the initial 6 to 8 weeks, you would have lost some weight from baby's weight, placenta, amniotic fluid, among others. So please, don't compare yourself to others. It's a pace or a step or a journey that you are taking on your own. Be gradual, enjoy the ride as you go, and it will end up well.